Welcome to Kisubi Hospital, established to provide high-quality medical services to the community around and the nation at large, with well-trained medical doctors and nurses with sophisticated machines to provide professional and timely health services to the client.
Kisubi Hospital is a faith-based, private not-for-profit hospital. It is owned by the Archdiocese of Kampala. It's at a level of general hospital, and we provide a wide range of services from outpatients to inpatients. And on top of that, we provide specialist services as well in a bid to provide holistic healthcare to our patients. We have a multidisciplinary team of 10 specialists, 6 general doctors, 38 paramedical staff, more than 90 nursing staff, and about 40 support staff. It is this team that helps us to provide consistently high-quality services in a compassionate and friendly environment.
The outpatient department caters for walk-in patients with a quick response team of well-trained medical and nursing staff trained to manage medical hazards as they come. This is monitored and supervised by well-trained physicians and a 24-hour ambulance service.
The moment the patients come in at OPD, they are registered at the desk. Their vitals are taken. Those include the weight, height, temperature, and the blood pressure. Once they are taken, they are sent to pay for consultation at the cash point. From there, after seeing the doctor, some patients are sent direct to the pharmacy to pick drugs. Others are sent for further investigations in radiology and the lab. And some are taken to orthopedics. We try as much as possible to reduce the time that the patient spends in OPD. And I can only do that with the other in-charges in the other departments. We also encourage our patients to call in at OPD. We have a line for appointments, which they can call in and make an appointment to see any doctor. This gives them priority when they come in, and they don't have to wait for long. Our outpatient department has special clinics on different days. For instance, we have the surgeon who comes in every Tuesdays. We have the ENT doctor who comes in every Wednesdays. We have the skin doctor every Friday, the dental clinic, which runs the whole week. We also have the eye clinic every first and third Wednesday of the month.
We also provide a wide range of specialist services, such as obstetrics and gynecology. We have physicians, we have ENT specialists, we have surgeons in a wide range of areas such as orthopedics, urology and general surgery. We have dermatologists and pediatricians.
Kisubi Hospital has a fully equipped modern laboratory that has made a track record in special tests like lung, kidney, genoendocrine, heart and muscle, liver, among others.
In our modern lab here, we perform various tests, of course tests that are not found elsewhere or that are rarely found in other clinics and hospitals around. We do cardiac assessment, which are tests to assess for the function of your heart. We do liver function tests and renal function tests. We also have a machine called a Mavuluni that performs immunohistochemistry, of which under immunohistochemistry we look at breast, leukemias, prostate and thyroid cancers, as well as fertility assessment for both females and males. For pregnant women, we perform a test that is called AFP, which is alpha-fetoprotein, and this test is very vital in assessment of whether the newborn child is at risk of developing what we call the neurotube defects, and at least we can be able to monitor and know what to do for your baby before they are given birth to. Our pride is that our results are accurate, reliable, and reproducible, making us one of the best laboratories in the nation today.
The imaging unit is open 24 hours and run by competent radiologists and radiographers. Services offered include X-rays, ultrasound scans, Doppler studies, barium studies, and echocardiography. Kisubi Hospital has a modern endoscopy unit which boasts of the following top-of-the-range endoscopy services.
The upper GI endoscopy that we do mostly are diagnostic, but also we are in the phase of starting intervention or therapeutic endoscopes.
Pussycat, pussycat, where have you been? Pussycat, pussycat, where have you been? I've been to London to visit the...
We handle most of the common childhood-related medical and surgical illnesses and emergencies. Things like malaria, pneumonia, HIV/AIDS, and many others you may think about, skin infections, even minor surgical emergencies like where children put foreign bodies in their body parts or orifices. We have the asthma, what we commonly call the chest clinic. We also, within this clinic, we treat children with respiratory associated allergies as well. Another clinic we run, specialized clinic, is the sickle cell clinic. This clinic runs on a Monday, and here we are looking at children who have sickle cell anemia. We have the HIV, AIDS, and TB clinic. This is a clinic that runs weekly, and it's on Wednesdays. We also have an adolescent health clinic. We have a neonatal stroke preterm clinic. This is a clinic for the babies who are born either when they have not yet made the full 9 months during their mother's pregnancy, called the preterms, and also those babies who have been born but after birth or during birth they've had medical or at worst surgical complications, and they may need follow-up and medication or health education. This clinic runs every Fridays, and all these specialized clinics I've talked about, they are manned by pediatricians. It's 24-hour service, 7 days a week. We ensure the children are well monitored, are well diagnosed for their ailments, treatment properly administered and monitored, and for those who get well, we ensure we follow them up so that they complete their treatment, and we also offer health education at the point of discharge as regards how to avoid their condition and any other related childhood illnesses.
Our adult ward admits both medical patients and surgical patients. We have 5 private rooms with 1 VIP. We have clinics, chronic care clinics, that run Monday to Friday. These clinics include hypertension clinic, diabetes clinic, cardiology clinic, gastroenterologist clinic, and chest clinic. The chest clinic for respiratory conditions is on Thursday in the afternoon and also on Wednesday in the afternoon. But the other patients, the other category of patients, can come in as walk-in patients or on appointments. We also have an isolation unit for people who have infectious diseases. We are talking about sputum positive tuberculosis, but also those who are tetanus patients who may need isolation, and away from other patients. And in isolation, from the time I've been here, we have so far managed 3 tetanus patients, and thanks to the team of nurses and other doctors I work with.
Kisubi Hospital has a high dependence unit, soon upgrading to an intensive care unit. This is where we admit very sick patients who are provided with excellent nursing care, with one-to-one nurse-patient ratio. The team of nurses is well trained, committed, and love what they do.
Lady Consolata, our Lady Consolata. Oh my, oh my.
When a mother comes, we take the weight, we take the blood pressure, and we book the mother for antenatal. We do the lab investigations, that is, we test for syphilis, we test for HIV, and that is a free service. We test for the amount of blood or the hemoglobin levels. We do urinalysis to make sure that the mother and the baby are okay and safe until the time of delivery. We offer other services like free immunization of the mother and the baby, postnatal care services, nature family planning. We have a fertility clinic that runs only on Friday. We also do cervical cancer screening that only runs on Tuesdays, and antenatal classes.
We have different units. We have antenatal, we have labor ward, we have gynecological, we have theatre services, we have screening of cancers, both with the cervix and the breast and the uterus. We have a team of 3 gynecologists and 2 medical officers. We learn special antenatal classes for mothers who are pregnant, where we teach them what is required for a pregnant woman, both at home and wherever it would be, together with what she's supposed to have for the betterment of the pregnancy and unborn baby. We tend to involve the husbands so that the pregnancy can grow very well and the mother gets helped by the partner. We do offer emergency obstetric services, which is one of the commonest problems that the health service in Uganda is facing. And the common one is the emergency intervention in mothers who require operation, who require blood transfusion, who require the management of a mother who needs urgent services within the shortest possible time. You can have a VIP treatment if you can afford. You can have a general treatment if you can't afford the other private services. But generally speaking, whoever walks in here will leave a happy mother and a father. Thank you very much.
It is advised for a pregnant mother to start antenatal as soon as they realize that they are pregnant, and to attend at least 4 hospital antenatal visits.
Chika is a special department which does a lot of things in the hospital, but mostly we deal with HIV and HIV-related services. In this department, we are concerned about 2 major things, and that is the facility-based and the outreaches. The services we offer at the hospital are the ones we call facility-based, and the ones that we do out there in the community are the ones we call the community-based services. Under the services we do, we test the children, the adolescents, the adults, and the pregnant mothers. The adolescents have their own unique corner, which we call the Adolescent Friendly Services Corner. And what we do is we test them, we give them psychosocial counseling, we give them life skills training, We give them peer education, among others. For the mothers, we also test them, and those who are HIV positive are also started on treatment so that we prevent transmission of HIV to the newly born baby and those babies that are still in utero. Other services we offer include STI screening, that is the screening for sexually transmitted infections. We also do TB screening, diagnosis and treatment. We also do services like cervical cancer screening, not forgetting other services like safe male circumcision. Safe male circumcision has been known to prevent contraction of HIV to about 60%. So it is very necessary for all our youths out there to come and join us. And the beauty of all these services that it is free of charge. Open from Monday to Friday, 8 to 5 p.m. And let's get you served.
Our Lady Consolata, consolation, Our Lady Consolata,
In Kisubi Hospital, we appreciate that transformation is a process that requires dynamism. And that's why we boast of the #1 well-equipped state-of-the-art theater in the country.
Among the surgical disciplines, we have got the following: general surgery, orthopedic surgery, ENT, which is surgery of the ear, nose and throat, urology, which is surgery of the urinary system, and colonoscopy, whereby we carry out colonoscopic examination of the lower GI system. What has enabled us to carry out this is availability of specialists from different surgical departments, and also availability of anesthetists and a wide team of nurses, presence of an intensive care unit which supports our theater, and above all, a very good hospital administration.
One of the support services offered at the hospital is a safe, friendly, and reliable hospital-based medical savings scheme. This account gives you an easy and convenient way to manage your health finances, giving you and your family an easy, safe, and secure access to treatment at all times.
How to access the health saving card? You fill a form, the officer on duty takes your photo, you pay 10,000 for the card, unlike the expectant mothers who access it freely. When all that is done, we issue you a health saving card. After opening up the account and you have your card, you can start saving your money with the hospital. You can choose to deposit the money directly with the cashiers who work 24 hours, or you can choose to deposit it using mobile money. When you choose to use mobile money, you have to be sure of the ID number that is on your card. Anytime you deposit this amount, you go back with a receipt showing how much you have deposited, how much was on the card, and the current standings of your accounts. With this card, you can have treatment not only to you, the card owner, but to your other relatives. As long as there is money on the card, any of your relatives can access treatment using the card. You don't have to worry about your money being used up with the end of either financial year or an annual year. You are entitled to a 5% discount. If you're an outpatient, the discount is only on drugs. If you're an inpatient, the discount is on the whole bill.
Kisubi Hospital Guest House is the apex of deluxe hospitality that offers international comfort and standards with a local charm. With a well-furnished living room fully connected to DSTV. The guest house has 2 self-contained bedrooms with a fully stocked kitchen that allows you to prepare your own meals. Our services, facilities, make the perfect destination hospitality in and around the area. If you're looking for a place to be, a place of relaxation, tranquility, Kisubi Hospital Guest House is your ideal place to be.
We we offer community services as a sign of giving back to our community. We have got medical camps organized twice a year, at the beginning and the end of the year. Through this, we get people with surgical problems which need surgery. We advertise through the radios, our community radios, and the hospital note spots to get the people. We do community outreaches whereby we visit the communities, we do the testing services, we can do immunization and all other services required in the community. We also offer home visits for better follow-up of patients who are under our care. We do appreciate and value our clients. That's why the customer care office is open for you. In case you have any problem, do not hesitate to visit the office. With that, we are committed to serve you with love.
For further information, contact our customer care on 0756 746 287. For appointments, 0751 881 773 or 0700 541 665. Email customercare@chisubihospital.co.ug or chisubi@ucmb.co.ug. Visit our website chisubihospital.co.ug.
Thank you for choosing Our Lady of Consolata Kisubi Hospital to take care of your health. We promise to serve you with love,
to offer total commitment to the sick, imitating Jesus Christ, who was always available to the needy. Comfort St. Mark chapter 6 verses 53 to 56.
God bless.
Yeah. Kisubi Hospital, long live. Hear the doctor say so. Our Lady of Consolation, Kisubi Hospital Redeem. Okama Bakume. Consolata.